Knee assessment and eval. Okay, so just like every other time, we're going to start with the history. So with the knee, you're just going to look at a couple different things. You're going to look for sound is a very important concept and question. Is there a pop, a crunch, a tearing? Those mean different things. If it's a pop, it's a lot of times it's a ligament, possible ACL. If it's a crunch feeling, a lot of times it's a meniscus, or tearing, it could be capsular or muscle. This would be part of your subjective section. You also want to look at, did swelling occur immediately? Because most likely if it's immediate, it's a cruciate ligament or a fracture. If it happens later, it's a lot of times it's a capsular or synovial or meniscal tear. When I say later, I'm talking later that night, the next day when they wake up, certain things like that. You want to make sure that they ask about locking or popping or movement when it's bent, or if it ever gets stuck or anything like that. Now, remember, in the objective section is also the observation. So not all these observations potentially are possible, but you want to do it immediately as soon as possible. So you want to see if they can bear weight or if they're guarding. A lot of times people are guarding their knee if they're walking with their knee slightly bent or flexed and on their toe. They don't want to extend their knee all the way. That normally means their knee is injured. Observe if they can squat, or if they can go up and down stairs. You might want to ask these questions before you ask them to perform them, simply because due to injury, they may or may not be able to do it. You want to look for symmetry and alignment as well. You want things to look symmetrical and normal. When do they limp? Are they even able to walk? When they walk, do they extend and have a heel strike? Can they use a box? Do they have full range of motion? It should be 0 to 135 degrees of flexion. We also want to look at leg alignment. So leg alignment deviations, they can predispose athletes to injury. These are meaning patella alta, patella baja, genu valgum, genu varum, genu recurvatum. Remember, patella is the kneecap, so patella alta. What's alta? High. Patella baja, low. So then genu valgum, genu varum. Remember, we talked about varus and valgus. So that's when your knees are knock-kneed or bow-legged. And genu recurvatum is when your knees are straight back. Do they look the same bilaterally? Are they symmetrical? Is one swollen? Is there atrophy present? You want to look at leg length discrepancy. So not everyone, actually everyone's legs are slightly different length. It depends if it matters or the degree of it that matters, and also if it's true or anatomical leg length discrepancy or it's a functional leg length discrepancy. A true leg length discrepancy is an anatomical measurement from the ASIS to the medial malleoli. Are the bones different lengths? However, functional is measured from the umbilicus to the medial malleoli, and this can change the length due to rotation of either the spine or the hip with muscle tightness. You want to, traditionally, you have hip pain or low back pain if it's slipped or rotated, and you want to look at the medial malleoli where it meets, and you want to look at the ASISs as well as the PSISs to see if they're level. That's how you can tell which one's slipped or which one's moved. So you want to have them lay down and potentially either on a dodgeball to help their hips, or just lay down and relax. And then you're going to have them bridge and get their hips back into where their quote-unquote normal is. And then you're going to look at their ASISs. Use your thumbs, evaluate it, see if they're level, check their medial malleoli, see if they're level, and depending on if there's a rotation, then you can make an adjustment on them as well using muscle synergy. We will go over that in class. You're also going to look at palpation. So just like everywhere else, you're going to palpate for pain, palpate for deformities, any fractures or dislocations. You want to see that with their legs straight as well as flexed to 90 degrees. So you want to, if you can't get into it, you can palpate supine with the knee in flexion that way. It just depends on what they're able to do. Medial aspect, you want to check the medial plateau, tibial plateau, the medial femoral condyle, the medial epicondyle, the adductor tubercle, and the medial femur and superior medial epicondyle. So basically you're checking all this inside of the leg. On the lateral side, you want to check the lateral tibial plateau, lateral femoral condyle, lateral epicondyle, the head of the fibula, Gerdy's tubercle, and anterior lateral tibial condyle. So if you don't remember where those are, use your anatomy worksheets and coloring to remember where those are, as well as be able to identify them on someone. So when you're looking at the patella, there is components to the patella. There's the superior patellar border, the base, or the inferior patellar border, which is the apex, basically the pointy part. When the knees relax and the knees in full extension, it's the easiest way to palpate the patella. You also want to look at the tibial tuberosity. That's the bump right below the patella. Then you're going to look at soft tissue. You're going to look at the vastus medialis, vastus lateralis, rectus femoris, quadricep tendon, sartorius, patellar tendon, anterior joint capsule. So remember all the anterior muscles you're going to go through. You're also going to look at all of the medial soft tissue, the MCL, the capsular portion, the superficial portion, the pes anserine, remember the sartorius, gracilis, and semitendinosus, all meet on that medial aspect right below the MCL. You're going to look at the medial joint capsules, see if there's any pain with that. You're also going to look posteriorly at the hamstrings, the semitendinosus, semimembranosus, the popliteus. You want to look at, remember, the lateral and medial gastroc heads, and also the bicep femoris. You also want to check the lateral, so the LCL, IT band, lateral joint capsule. Remember, we were basically going to palpate everywhere around the knee. So remember, going through hips, hops, and SOAP. History is the component of the subjective. Then we've got observation, part of the objective. And then we've got palpation, part of the objective. All right, and then we're going to have special tests, which we'll do in class. And then we can go from there.